Hello, I'm here again with Dr. Atul Gupta, Medical Director of Infection Prevention here at Silver Cross. It's Friday, March 20th, and the end of a very tough week. Would you agree?
Yes, it's been a busy week, and I think we're really just at the beginning of the spread of this virus in Illinois. But I also expect that the measures that we're taking now, that were being put in place and have been put in place, I think we will see some benefits to those measures. Everyone staying at home, keeping their distance, washing their hands. I think that'll make a big difference.
Okay, and can you give us some information about the precautions we've taken at Silver Cross?
We've taken many precautions to get ahead of this. The main one is that we're no longer allowing any visitors except with very certain exceptions. And we're also, even when we have patients in the hospital who we suspect of having this disease, we're limiting the number of care providers that enter the room so that people aren't exposed to it and then potentially spreading it to other people.
Okay, thank you for telling us that. Many people have asked us if we need a tent at this time. What's your opinion on that?
At the present time, I don't think we need a tent. We have protocols in place to test people in a safe manner. We've set up actually many isolation rooms inside the hospital in the emergency room. We're working on expanding that number even more. And so I don't think there's any benefit to a tent right now.
Okay, great. But if we need one in the future, we've already made the arrangements and we can quickly deploy one.
We'll be ready.
Can you also remind people what are the symptoms they should be watching for COVID-19?
Sure. The main symptoms are still fever, cough, shortness of breath, and body aches also, some people have. And if you do notice you have any of those symptoms, we ask that you contact your primary care doctor to seek further guidance.
Okay. And we've made arrangements here at Silver Cross. If you don't have a primary care physician, you can call 815-462-3259, and we will help connect you with a primary care physician. So that's 815-462-3259. So if someone does develop the disease but does not need to be hospitalized, how long do they have to stay home? How long will they have this?
We have new recommendations from IDPH in the last couple of days. If you are symptomatic, you should stay at home until 7 days after the symptoms start or 72 hours after you no longer have fevers or other symptoms, whichever one is longer.
Okay. So let me ask you, you're on the front line every single day. What do you do to stay healthy and keep yourself safe?
Just the things everyone knows to do, to exercise, get plenty of sleep, eat healthy, and take some time for your mental health. Take some time away from watching the news, spend time with family. There are good things in life to focus on.
Absolutely.
That's right.
I think that's really good advice. And, speaking of that, please, if you have a family member or a friend or a neighbor that works in healthcare, please reach out to them and tell them how much you appreciate them and thank them for the work they're doing. They are on the front line every day, and it's doctors and it's nurses, but it's a lot of other people too. It's our environmental services people who clean the rooms. It's our respiratory therapists and phlebotomists who take people's blood, and the list goes on and on and on. I am grateful for everything that all these folks are doing here at Silver Cross.